Namaste everyone, welcome to Physio Vitals. I'm Dr. Ankita Sawant and today's video is about metacarpal bones. So, metacarpals are the bones, metacarpals are 5 miniature long bones which are numbered from lateral to medial side. Lateral to medial. Starts from thumb area, then index finger, middle, ring finger and little finger. Moving further, and each has a shaft, head and a base. Alright, so head is rounded. It has an articular surface which extends more antero-posteriorly. Antero-posteriorly, this way. This is anterior and posterior. So head is rounded and has an articular surface which extends more antero-posteriorly than laterally. Fine. Moving further, it extends more on the palmar surface than on the dorsal surface. Palmar surface is the palm wala surface. The dorsal is the posterior surface. Alright, so it extends more on the palmar surface than on the dorsal surface. The heads of the metacarpal bones form the knuckle. Alright, our knuckle area which is formed, this area is formed by the heads of the metacarpal bones. Alright, now the shaft is concave on the palmar surface. See, our palm is slightly curved, right, inwards. There's a cave-like structure on our palm. Lateral view of these are the fingers 1 2 3 4 5. Okay, so this palm is slightly, shaft is concave on the palmar surface. This is dorsal. So its dorsal surface bears a flat triangular area in its distal part. The base is irregularly expand. The base jo hai, that is irregularly expanded. Now, the metacarpal bones are distinguished from the metacarpal bones. The head and the metacarpal's head and shaft are prismoid, whereas metatarsals, जो अपने पैर में होता है, the head and shaft are flattened from the side to side. Now, in metacarpals, the shaft is of uniform thickness. In metatarsals, the shaft is tapered distally. Now, the dorsal surface of the metacarpals, the shaft has an elongated flat triangular area, whereas metatarsals, there is dorsal surface of the shaft is uniformly convex. In metacarpals again, the base is irregular. In metatarsals, the base appears to be cut sharply and obliquely. Moving further to the characteristics. Now, first we'll see the characteristics of metacarpal. So, it is the shortest and stoutest of all metacarpal bones. Alright, it's the shortest of all metacarpal. The base is occupied by a convex-concave articular surface for the trapezium. Now, as you can see here, this is the first metacarpal. Here it is the trapezium, right? So, what the thing is, the base is occupied by convexo-concave articular surface for the trapezium. See, this is the bone trapezium. Alright, so it articulates with the trapezium. The dorsal surface of the shaft is uniformly convex. Dorsal surface is uniformly convex. Because the palmar surface is concave, the dorsal surface is convex. Alright. The head is less convex and borders from side to side than the heads of other metacarpals. The ulnar and radial corners of the palmar surface shows impression for sesamoid bones. The first metacarpal bone is rotated medially through 90 degree relative to the other metacarpals. As a result of this rotation, the movement of the thumb takes place at right angle to those of other digits. Alright, जो first metacarpal bone है, this is rotated medially through 90 degree related to other metacarpals. That's the reason the movement of the thumb takes place at the right angle to those of other digits. Moving further to the second now. Alright, so also one more point, it does not articulate with any other metacarpal bone. So the first metacarpal does not articulate with any other metacarpal bones. Moving further now to the second metacarpal. So the base is grooved from before backwards. The medial edge of the groove is larger. Alright, the medial edge is larger of the groove. Alright. So base is grooved, sorry, it should come S here, by mistake it's a typing error. Base is grooved from before backwards. The medial edge of the groove is larger. Now the third metacarpal, the base has a styloid process projecting up from the dorsolateral corner. Fourth metacarpal, the base has two small oval facets on its lateral side for the third metacarpal, and on its medial side it has a single elongated facet for the fifth metacarpal. Moving further to the fifth now. So the base has an elongated articular strip on its lateral side for the fourth metacarpal. The medial side of the base is non-articular and bears a tubercle. Moving further to side determination. Now, in metacarpals, first metacarpal, the anterolateral surface is larger than the anteromedial surface. Alright, anterolateral is larger because it's the outer side. So that surface is the larger than the anteromedial side. Second metacarpal में, the medial edge of the groove on the base is deeper than the lateral edge. Medial edge of the groove on the base is deeper than the lateral edge. The medial side of the base bears an articular strip which is constricted in the middle. Now the third metacarpal, the styloid process is dorsolateral. The lateral side of the base bears an articular strip which is constricted in the middle. The medial side of the base has two small oval facets for the fourth metacarpal. Now the fourth metacarpal, the lateral side of the base has two small oval facets for the third metacarpal. Alright, the medial side of the base elongates and has an elongated articular strip for the fifth. Now see, this second metacarpal articulates with the third. Likewise, third articulates with second and fourth. Likewise, fourth articulates with third and fifth. And fifth articulates with four. But other than fourth, fifth doesn't have any other articulation. So that's the only like side determination and articulation in the metacarpals. So we were on now fifth metacarpal. The lateral side of the base has an elongated articular strip for the fourth, right? Lateral side, fifth का जो lateral side है which is fourth, तो it has an elongated articular strip for fourth metacarpal. The medial side of the base is non-articular because we don't have any other finger left over, right? Other than the fifth. We just have that 5 metacarpals. We don't have a 6th metacarpal. If we would have 6th metacarpal, then we could have said here that there is also an elongated articular strip for the 5th. But that's not the case here. So the medial side of the base is non-articular and has a tubercle. Alright, now attachments. So further, first the opponent's pollicis. Alright, opponent's pollicis is inserted on the radial border of the anterolateral surface of the shaft. See, opponent's pollicis, this muscle. So, inserts on the radial border and the anterolateral surface of the shaft. Now, abductor pollicis longus. Abductor pollicis longus is inserted on the lateral side of the base. So, abductor pollicis longus inserts on the lateral side of the base. Then, palmar interosseous muscle arises from the ulnar side of the base. Alright, palmar interosseous, adductor pollicis, flex. Alright, these two muscles. Then moving further to the flexor carpi radialis. Now flexor carpi radialis, this muscle. So is inserted on a tubercle on the palmar surface of the base. Palmar surface of the base. Now the extensor carpi radialis longus. Extensor carpi radialis longus, this muscle, is inserted on the dorsal surface of the base. Oblique head of the adductor pollicis arises from the palmar surface of the base. A slip. Now the third metacarpal, as we saw here. We saw first metacarpal has opponens pollicis, abductor pollicis longus, palmar interosseous. Second has flexor carpi radialis, extensor carpi radialis longus, oblique head of the adductor pollicis. Now moving further to the third. Now third, a slip from the flexor carpi radialis. Alright, flexor carpi radialis, this muscle is inserted on the palmar surface of the base. See, this is the palmar surface of the base. Then extensor carpi radialis brevis, here, extensor carpi radialis brevis is inserted on the dorsal surface of the base immediately beyond the styloid process. Alright, then again third has oblique head of the adductor pollicis, which arises from the palmar surface of the base. Alright, then transverse head of the adductor pollicis arises from the distal 2/3 of the palmar surface of the shaft. Alright, moving further to the fourth. Fourth just has only the interossea arises from it. Now fifth metacarpal, the extensor carpi ulnaris. See, extensor carpi ulnaris and fifth has extensor carpi ulnaris is inserted on the tubercle at the base. The opponens digiti minimi. Opponens digiti minimi is inserted. See here. Alright, this. Wait, I'll show you. Yeah. Opponens digiti minimi is inserted on the medial surface of the shaft. Moving further. So these were the attachments throughout the first to fifth metacarpals. Moving further now to the articulations at the bases. Alright, so first metacarpal articulates with the trapezium, as we saw on the picture before. This picture. See, it first articulates with trapezium and forms a saddle shaped joint, concave or convex. Alright, convex or concave, whatever. Then the second metacarpal articulates with trapezium. See, now you need to understand this. This is the second. It also articulates with trapezium. It articulates with trapezoid as well. Then capitate and third metacarpal. As you can see, capitate here and also the third metacarpal. So this four things articulates with the second. Alright. Likewise, now we'll move further to the third. Third articulates with capitate. Here is the capitate. Alright, this is the third. Articulates with capitate and second and fourth metacarpal. Alright, so this is the articulation. Now, moving on to fourth. Fourth articulates with capitate, hamate, and third and fifth. Alright, third and fifth. Moving further to the fifth with the hamate and the fourth metacarpal. As you can see here, we have hamate and the fourth metacarpal. So just this thing. Alright, so this was the articulation at the basis. Now moving further to the ossifications now. The shaft ossifies from one primary center each, which appears during the 9th week. Alright, which appears during the 9th week of the development. Primary. Now the secondary center for the head appears in second to fifth metacarpal, and for the base in its first metacarpal. It appears during the second to third year and fuses with the shaft about 16 to 18 years. Now moving further to clinical anatomy. What is Binet's fracture? Binet's fracture means fracture of the base of the first metacarpal. It involves the anterior part of the base and is caused by a force along its long axis. The thumb is forced into a semi-flexed position and cannot be opposed. The fist cannot be clenched. Now the other metacarpal fracture may also be by the direct or indirect violence. Direct violence usually displaces the fractured segment forwards. Indirect violence displaces them backwards. Now, what is polydactyly? This is when a child has a, like we as a normal person, we have 5 fingers, right? This is the thumb and then the other finger. So in polydactylism, what happens? The person has extra finger. Ritik Roshan. All right. So it's not uh, uh, necessary that the extra finger is just going to grow from the thumb only. Also only, it can also grow from little finger. So it doesn't have that the only pattern of growing from one particular finger. It can grow anywhere, which is called as polydactyl. All right. I hope you liked the video and was useful for it. Do not forget to like, share and subscribe to my channel. And next video will be on phalanges. So stay tuned for that. Thank you.